Good afternoon, and thank you for inviting me to present to you today. My name is Terri Menser. I'm a scientist and an assistant professor at the Center for Outcomes Research at the Houston Methodist Research Institute. I'd like to take a minute to thank and introduce our study team. We have Drs. Shi and Karmanik, both at our Translational Imaging Center, who were instrumental in both the implementation and carrying out the research design. Dr. Kenneth Podell is our neuropsychiatrist, and his expertise were of extreme value. And then we have Dr. Simon Freet is our postdoctoral fellow who was largely responsible for recruiting and walking our residents through the actual process of completing assessments and getting their fMRIs, assisted by Jacob Sion and Megan Taubert. Dr. Beta Cash is our center director, and this project was actually of her conception over a year ago, so thank you, Beta. To start off with, I'd like to discuss the importance of nature and why it's worth a better understanding of its restorative effects. We know that nature can improve various health outcomes, and it's important to one's overall well-being. But the study of nature's effects remains challenging. Examples of health outcomes associated with exposure to nature include the increased ability to cope with illness, decreased stress and anxiety, improved cognitive function, and decreased pain in some instances. But measuring nature's effects can be challenging because the mechanisms are influenced by multiple factors, and experimental conditions are difficult to control. So the use of fMRI technology offers a mean of examining nature's effect in a controlled setting with replicable results, and examining neurological activation patterns to test the restorative effects of nature is a method that to date has been underutilized. We are particularly interested in this study in understanding nature's effect on stress and burnout, given the prevalence of burnout in our healthcare professions. Now, burnout affects more than half of practicing physicians nationwide. We know that there's a link between burnout and undesirable outcomes. These include medical errors, having individuals leave the profession early, reducing their hours, changing organizations. There are factors that must align in order for burnout to remain in a manageable state. And these factors include workload, control, reward, community, fairness, and values. So when any of these factors are out of alignment with what one expects and what one realizes, it results in stress, and that stress over time results in burnout, which is a condition that is characterized by emotional exhaustion, followed usually by depersonalization, detaching from one's work. And then the third category of burnout is decreased self-efficacy or decreased personal accomplishment. The level of stress or the level of burnout becomes such a high degree that it actually affects your ability to feel that you can complete your job. And so what we're doing here is we're wanting to see what the relationship is between stress and burnout and see what kind of connection can be made. Now, the first step of this study, in order to do an fMRI study that examines images of nature, we first had to validate images for the study. Now, for the study, we used 3 types of images. And here I'm focusing on the nature images because we did some post-hoc analyses on these images. But in general, we had to find and validate images of nature, images for a control group that were urban images, and then we also found images of empathy-related stress. Stress that was induced by seeing others in pain or discomfort, individuals crying. I'll show some examples here shortly. But for the nature images, we wanted to say, well, now that we've had these images validated, which we did through an online survey that was sent to a convenient sample of students at Texas A&M University, there were roughly 300 images, 129 of them were nature images. And once we got these results back of what images participants found least representative of nature and most representative of nature, we took that opportunity to use that data to say what characteristics or what properties of nature are most predictive of people finding it most highly associated. And so if you look here at this slide, you'll see that canopies, bodies of water, and mountains are largely across our top 10 highest rated images that were actually used in the study. In the study, we used 10 images from each category. Above here, you'll see our actual results from our model, which show what was interesting, there's two features that actually were negatively associated. And so one of those was unnatural elements. For example, images that had a sidewalk or a garden hose or something that was in any way unnatural were coded binarily as having an unnatural element. And so those images scored more as least representative of nature than images without unnatural elements. Additionally, close range views were not scored as highly, and there was a negative association there. From this validation process, we selected our images to be used in our fMRI study. Here are examples of nature images that were selected and rated highly. Here are examples of our control images, which are urban images. And here are examples of our empathy-related stress images. Our research design encompassed multiple techniques, which included the traditional block design for tasks that were enumerated, in addition to resting brain state for comparison of neuroconnectivity. I'd like to turn the pulpit over to Dr. Shi to go through our initial analyses of our nature participants. Thank you all so very much.
Thank you, Terry. My name is Zhaoyue, and I will be presenting the fMRI results section. A total of 26 subjects were analyzed. Here, task 1 refers to viewing the empathy images, and task 2 refers to viewing the nature images. The fMRI results show that during task 1, the act of viewing empathy images were found to activate the bilateral amygdala, which is related to fear, and the IFG and TPJ, which are both related to stress and burnout. During task 2, when viewing nature images, the activation of amygdala was weaker compared to task 1, and no TPJ and left IFG was activated. When comparing task 1 and task 2, it is clear that there were more significant activation in areas related to stress and burnout for subjects viewing empathy images compared to subjects viewing nature images. In task 3, where subjects viewed the same set of empathy images the second time, their brain activations were very similar to those from task 1. Our aim is to investigate whether viewing nature images can help to reduce subjects' burnout level and act as a buffer to decrease the activation of areas related to stress when viewing empathy images. When comparing task 1 and task 3, we found that subjects with high burnout showed less activations in areas related to burnout in task 3 than task 1. This suggests that the act of viewing nature images helped them reduce the burnout level. However, this phenomenon was not observed in low burnout subjects. When analyzing all 26 subjects, including the 9 non-burnout subjects, there was no significant difference in brain activations between subjects participating in task 1 and task 3. These results suggest that viewing nature images for 3 minutes was capable of evoking a lasting effect in the subjects with high burnout, but not for everyone. I'd like to take a minute to briefly introduce our Translational Imaging Center at Houston Methodist Research Institute. We have 2 MR scanners, a 3T and a 7T, and a PET-CT scanner. T is short for Tesla, which measures the magnetic field. Our star is the 7T scanner, which is a FDA-approved ultra-high field MR scanner. We just got it last year. It's the first and only one in Texas and one of 7 in the entire country. As you can see from the comparison between the 3T and 7T images, the 7T MRI offers higher signal-to-noise ratio, spatial resolution, tissue contrast, etc. And the brain activations are also found to be more robust in 7T compared to 3T. If you're interested in finding out what's going on in the brain, please feel free to contact us. We have many successful collaborations with various hospitals, institutes, and universities, including Texas A&M. Thank you.